based in the US with presence in 9 countries internationally, and I will be moderating this session. For decades, drug prohibition and a variety of prevention programs have been enacted with an aim of eliminating drug use among people, and especially young people. Banning substances stops a conversation about how we go about dealing with young people and drugs, but doesn't ultimately stop young people from seeking drugs out and using them regardless of those laws or punishment-based consequences. For example, of 21 million college students in the United States, this month, about 8 million of them will use alcohol, 4 million will use marijuana, and another 4 million will use another illicit substance. The aim of this session is to explore the idea that drug prohibition endeavors to protect young people from drugs, but in many ways fails to protect those who will inevitably use drugs from their direct harms. We have representatives here from SSDP, SSDP UK, and Canadian SSDP. 3 related organizations, independent but collaborative organizations, I should say, all working from the same philosophy in different countries. The idea that in order to truly protect young people and create safer spaces for them and safer experiences for them as they are growing up, we must take new approaches that acknowledge the fact that some young people are inevitably going to use drugs. And we must protect those young people, as well as all of the others. We'll start today with Zara Snap. Zara is the Communications and Policy Manager for Latin America for the Global Commission on Drug Policy.
Thanks. I'm also very happy with all these people I have on this one panel, and we have our gender quota with Rafa as the only man, so I think we're trying to change things up at the UN when we look up at the front, and it's mainly all men and maybe one woman, so I'm glad that we're changing it around. So as Betty said, my name is Zara Snap. Several years ago I worked with Students for Sensible Drug Policy, and now I work for the Global Commission on Drug Policy, which is a group of ex-presidents and high-level people who want to speak out on drug policy. I'm based in Mexico City. It's where I was born and raised, and I went to school in the United States. So today I'm really going to focus on Mexico and a bit on Latin America, but if there's any questions about it, feel free. So Mexico is in a place of crisis. It's a humanitarian crisis, what's happening in Mexico. Here at the CND, our Office of Foreign Relations is quite good, and they speak very well, and we're proud that they are taking a progressive voice in the debate on drug policy. But this doesn't take away from what's happening inside the country. And it's not just affecting young people, although many of the people who have been killed or disappeared over the last 7 years are young people. It's also affecting everyone. And it's also not just about drug use, but it's about drug production and drug trafficking. So I just wanted to be clear that we are happy with the position that Mexico is taking on an international level. We hope to see that translated into some domestic changes in Mexico. In 2006, Presidente Felipe Calderón launched the war on drugs in Mexico with the support of the United States. Rather than having cops on the streets who are trained to serve and protect, they put the military on the streets. They militarized our public security. And what happened with that is that there was a dramatic increase in human rights violations, in violence, and the criminalization of youth and young people. So essentially, if you were poor, if you were young, one of the two, you were often criminalized and considered collateral damage in the war on drugs. This full-on conflict between organized crime and the military caused a disintegration of many communities, primarily in the north, because that's where the majority of the traffic was going, but also along the sides of the country, along the coasts. Civilians were caught in much of that. Where joint operations are held, violence has surged. And often there's a clear collusion between the military and organized criminal groups, or local officials and organized crime, it's local. When they cut off the heads of organized criminal groups, all that does is creates more violence as people battle for power and to take over certain territories. So we have not seen a huge difference when they arrest El Chapo Guzman to today. All we see is then more people battling for power. This has caused institutions, confidence in institutions to plummet. One might say that we're having a crisis of institutions. We're having a political crisis, we're also having a humanitarian crisis. So both the war on drugs and our institutions have failed. This dual failure has manifested itself into a complete lack of rule of law. We have impunity rates of 98%. Since 2006, we've had over 100,000 people who've been killed, over 26,000 people who've been disappeared. This means we don't know where they are. They left their homes to go to a place. Maybe they talked to their family members. They went through a military checkpoint, and then we don't know what happened to them. No ransom has been demanded. Their families haven't been contacted. And normally the state doesn't do much to try and find them. The response often is they must have been involved with something. Otherwise, nothing would have happened to them. We've reached a tipping point where it's no longer possible to use that argument. We know that these people were not all involved in the drug trade. And even if they were, they do not deserve to be disappeared and to have their loved ones be in a very difficult place of hoping that someday they will find their loved one, but also needing to have closure in their lives. So the government throughout this oftentimes tried to silence voices asking for justice, but it's no longer possible anymore. Too many people are getting involved, and in Mexico, young people who are working on drug policy reforms are often organizing also with victims. They are connecting with the victims to give them voice. And they're organizing around against the violence. Our greatest goal in pushing for drug policy reform, in addition to respecting the rights of users, is to reduce violence and to take resources away from organized crime. Organizations such as Rever de Ser Colectivo in Mexico are working hand in hand with the victims movement, such as the Movement for Peace with Justice and Dignity, which is led by the poet Javier Sicilia, to help them in their search for truth, justice, and memory. So it's also about finding out what really happened and not allowing the government to cover it up. So these people have family members who have either been disappeared or killed due to the violence. And the youth movement in Mexico has primarily been there to support them. They work with them to organize against these structural prejudices and discrimination, and they also work on highlighting the connections between drug trafficking and drug production and the violence that we're currently experiencing. So for us, that is one piece of a greater puzzle, but it's an important piece, and it's a very concrete piece that we can work towards. Probably right now, the most famous case that most of us know about and that has been in the news is about the students of Ayotzinapa, who the 43 college students who were training to become teachers, who were disappeared. The connections between local government, organized crime, and then also just a politicized population creates a space where it's impossible to have real clarity about what happened. You don't know if it was the state, you don't know if it was organized crime, and oftentimes it becomes so intertwined that it's very hard to pick apart the pieces. In Mexico, we technically have a policy of decriminalization. But in Mexico, that means 5 grams of cannabis and half a gram of cocaine, for example. We have a whole list of the different substances. Those amounts do not reflect reality. You cannot go, and decriminalization in and of itself causes you to break the law by going and buying and then carrying it. That act is breaking the law, even though then you're allowed to have it on your possession for your personal use. You can't go find 5 grams of cannabis to buy. They're going to sell it to you in a larger amount. In addition to the fact that you're not going to put yourself at risk every 4, 5, 6 days to go and buy in an illegal market that is ruled by violence and organized crime. So the most likely scenario is that if you are caught with an amount of drugs, and particularly if you're a young person who are overly checked and searched, the most likely scenario is that the police will take you to an ATM and you will take out money to bribe them. And that's the fine that you pay. That's the best case scenario. Otherwise, you get taken to a prison or to a jail and you don't know what they might accuse you of. So right now we're working with the government to try and raise the legal amounts that people can carry, so to make the decriminalization actually effective. Although decriminalization is a first step, The youth movement and the drug policy reform movement in Mexico doesn't stop there. We recognize that there's a dire, urgent need for legal regulated markets. We have to differentiate between those who are involved in the cultivation and trafficking of substances, or in small-scale dealing, from those who are actually involved with the high-impact violent crimes, such as extortion, kidnapping, murder, disappearances. So we really need to be able to differentiate and be able to focus our efforts on reducing high-impact crimes and not be dedicating resources so much to drug trafficking. Oftentimes also those who are involved in the drug trade in Mexico are doing so because it's their best economic option. They are making the best economic choice for them. These are the opportunities that they have. Right now our market is regulated in a certain sense. It's regulated by organized crime. It's ruled by violence.
Sorry.
It's my time.
So sorry.
She doesn't finish what she's telling me.
Please finish your sentence.
Yeah, it's ruled by...
So sorry.
It is a regulated market, but we prefer, no matter, even if the state is corrupt, even if we have our doubts about the capacity of our institutions, we prefer to put our faith in them than in organized crime. We prefer to have someone from whom we can ask for accountability and transparency. So we recognize that it's important to put that into the hands of government. Uruguay, the example of Uruguay has been very important for us in Mexico and throughout Latin America, and we're all waiting to see how it all comes out. The cannabis clubs are up and functioning, and we recognize that what they are doing is giving precedence to human rights over their drug control treaties. And that they are ensuring that there's a separation of markets, where people who are seeking cannabis will only be offered cannabis rather than other drugs. We believe that we should be departing from reality and not a utopia of a drug-free world. And so that is what, in Mexico, the reality has hit us hardest, and we want to depart from that. We don't want to say that something is possible that isn't. There is hope, though, to end on a more positive note. There are certain programs that have been implemented in Mexico City around the analysis of substances so that we can test them and see what is in them, how they're adulterated, and that way we can provide a better public service to people who are going to use drugs. As Betty said, we don't believe that a drug-free world is necessarily even a good thing, and so it's better for us to be able to give people information, clear guidelines on how to reduce the harm they might do to themselves by using drugs, but also the benefits that might be possible. So, yes, done.
From SSDP in the United States, we have 2 members of our board of directors representing the U.S. Student Voice. Rafael Gonzalez is from the state of Texas and attends Alamo Colleges, and Sarah Merrigan is from Nebraska and attends the University of Nebraska at Omaha. Rafael?
Guten Tag, everybody, or as they say where I'm from, howdy. And where I'm from, it's not very far from Mexico. It's right across the border, San Antonio, Texas. And speaking of markets, there's a growing problem that's been affecting a lot of youth, including dear friends of mine. And the problem that I'm talking about is synthetic cannabinoids. Now, researchers affiliated with New York University Center for Drug Use and HIV Research have released a pretty brand new study, came out a couple of days ago, March 2nd actually. Synthetic cannabinoid use in a nationally representative sample of US high school seniors. Now, they found that synthetic cannabinoid use is growing. In 2011, they studied 11,863 students. It's the second most commonly used drug right after real marijuana. Now, this drug is completely legal. It is legal. Like, you could buy this on a street corner depending on where you live. And it's basically poison. A couple of years ago, we were at a party when a friend of mine partook in synthetic cannabinoids. You know, he was a recreational marijuana smoker, and he figured it's basically the same thing. About 30 minutes later, after he took a couple of puffs, I guess, he started feeling nauseous. He started getting headaches. He started kind of mumbling when he spoke. Us thinking, you know, oh, he's probably just playing off or he's doing something. We were wrong. Eventually, he started vomiting, projectile vomiting. Eventually, he ended up laying down on the floor in the fetal position, crying. He was speaking incoherently. He was not making sense. We were scared. We didn't know what to do. We actually did not call the ambulance. We did not report this. Eventually, thank God, he was fine. And, but that experience shook me. And as I said before, it's basically poison. From January 2009 to April 2012, 11,561 poisonings were reported from synthetic cannabinoid use. Ours was not reported, which only makes you think about how many are not being reported. As I said before, these are completely legal. People use this as a legal alternative to smoking cannabis. There are countless people that I've met personally who still partake in this, and they do it because either one, they have a job, which requires drug testing. This does not show up on drug testing, not yet at least. Two, they are on probation from a prior cannabis drug charge usually. And it's alternative to smoking cannabis and coming out dirty, whereas you could smoke this and be clean, as I said before. And three, sometimes people are being drug tested by their own parents. It's a way to get around it. It's a way to get around smoking cannabis, yet it's more dangerous than actually smoking cannabis. And speaking of cannabis, very few never users of marijuana have partaken in these illegal cannabinoids, which means that chances are you smoke cannabis if you smoke this stuff. They found only 0.5% of people who never partook in cannabis that use these cannabinoids. And it's a growing danger in America at least. I'm not sure what the statistics are for Europe and stuff, but I believe that it could be a problem that will grow in other nations. And I believe that cannabis prohibition is actually making the numbers of people who partake in these legal alternatives grow. And I can't wait to see what research comes out of Colorado, and we see how many poisonings were reported there.
Today, I will be telling the story of Shelley Goldsmith. Shelley Goldsmith was born November 11th, 1993. She was an honors student at the University of Virginia and a recipient of the prestigious Jefferson Scholarship. She was described by her parents as healthy, happy, academically strong, and well-adjusted. She was known for being a starry-eyed idealist who wanted to change the world. She was a volunteer in her community. She was a member of a sorority. She was an ally for she started a chapter of a Gay-Straight Alliance at her local high school, which in rural Virginia, where she was from, was a very bold move. She was even threatened with a lawsuit against herself specifically for her support of her friends. She was considered everyone's best friend. There was no troubled past, there was no history of problematic drug use. But on August 31st, 2013, Shelley attended an electric dance music concert, EDM, with her friends in Washington, D.C., and took some MDMA. Unfortunately for Shelley, this incident resulted in a heat stroke. She was dancing with her friends at the concert, and she had no access to free water. There was no space for her to go and cool down. And she was not provided with any medical care. This is a result of the RAVE Act. Introduced in 2002 by current Vice President Joe Biden, who's then a senator, it was known as Reducing Americans' Vulnerability to Ecstasy. This act was intended to give law enforcement better tools to crack down on event organizers and other event promoters who were knowingly encouraging the illicit use of illicit substances. Passed the next year by Congress as the Illicit Drug Anti-Proliferation Act. This law has effectively deterred any kind of event organizer from providing any sort of harm reduction services to their attendees. As I mentioned in Shelley's case, they do not provide their patrons with free water. They often don't have spaces where people can go and cool down after aerobic activity and dancing and things like that, being in a large crowd. And unfortunately, a heat stroke can happen to anybody. And while it's well known that stimulants and substances like MDMA will increase your risk of acute stroke, it can even happen if you are not using drugs. And it's important to note that Shelley took MDMA. And we often, when you think of MDMA, you hear the term Molly. Molly is something that, in many cases, can be adulterated, but that was not the case with Shelley Goldsmith. And MDMA-related fatalities are very rarely the result of an overdose when it is purely MDMA. They, as you can see here, they're most often a combination of environmental factors such as the overheating that results from being in a large crowd, aerobic activity like dancing when you're at a concert, and dehydration when you don't have access to free water. Shelley's mother, Dee Dee Goldsmith, after finding out the circumstances around Shelley's death, created a website and partnered with a few organizations called Amend the Rave Act. She's reached out to many different law enforcement groups, politicians, and other organizations in an attempt to basically make change and create safer spaces for young people, because young people, such as Shelley, use drugs. Some of them use drugs for reasons as an escape, and others use drugs because they want to enhance the pleasurable experiences, such as an EDM concert. So the purpose of Dee Dee Goldsmith's Amend the Rave Act campaign is to allow these event organizers and their facilities to feel more comfortable providing harm reduction services to the youth that are attending their events. Because as a result of the Rave Act, they feel that even providing any kind of harm reduction service puts them at the risk of being prosecuted by federal law enforcement for encouraging drug use. And it's important to note that attempting to reduce the harms of drug use is not the same as encouraging it. But we need to recognize and acknowledge that if young people are going to be doing drugs, we need to make sure that they are being taken care of and that they have access to any kind of treatment that they can need.
Thank you, Sarah. Next, we'll hear from Canadian Students for Sensible Drug Policy. Lisa Campbell is the Outreach Director there, and Nazli Maghsoubi is the Chair of the Board and a student in the Master's Program at the University of Toronto. Thank you.
Thank you so much to everyone who shared so far. It's really inspiring to see the work that we're doing in our respective countries. So today we're going to be talking about protecting youth from drug policy, and we're going to be going over a few key trends that we've been finding in Canada in relation to harm reduction and also prevention for young people who use drugs. So the first trend that we're seeing is new psychoactive substances. So this has been discussed widely at the UN CND. There's been a proliferation of new psychoactive substances that we're finding over the years. And as of 2013, there's been 348 new psychoactive substances identified. So we can imagine that in 2015, there's probably a lot more. I think that it was mentioned this week that there's 2 per week that they're discovering. So if you can, do the math, it's a growing problem, and it's really hard to get information about these substances. There's a lot of mislabeling. It's important not to make generalizations because each of these substances are very different and their harms are different as well. So we can't say that new psychoactive substances are dangerous, but what we can say is that the proliferation and the mislabeling and adulteration in drugs is definitely a problem.
Right. So a second trend that we've seen in Canada is the normalization and the perception of MDMA as a pure substance, which was alluded to by my colleague Sarah in the reference to Molly. So essentially, Molly is perceived now amongst Canadian youth as a substance that is not adulterated with other drugs and is therefore relatively safe for consumption. So what this means is that they're not taking the appropriate risk mitigation or preparation that they would perhaps take otherwise. So essentially these two trends are really problematic because they augment each other. So we have the situation where NPS is potentially increasing the risk because it's used as an adulterant in more traditional substances like MDMA. And at the same time, youth are not taking the adequate risk preparation strategies because the change in perception around this MDMA, this typically taken party drug. So these two trends are very problematic for us. And the reason why it's important is because amphetamine-type stimulants like MDMA have remained relatively popular with young people over the past decade. And currently, they're more prevalent than non-prescription opiates, so like heroin, in North America. So their use is something that we need to be concerned about. Additionally, the problems that arise because of these two trends are dire. This summer and throughout the past year, we've seen a lot of deaths and a lot of health complications as a result. So really, they require our urgent attention. So these two trends we want to outline because they feed into prevention and harm reduction, which we'll be discussing today in Canada. So I'm going to start with prevention. So if we can turn to the slide here, I have a quote from a paper written by the International Center for Science on Drug Policy. And as you can see, it says, existing evidence suggests that the dissemination of anti-illicit drug PSAs may have a limited impact on the intention to use illicit drugs or the patterns of illicit drug use among target populations. So essentially what this is saying is that PSAs, as we have implemented, as we understand them, are not necessarily effective. Although I have a couple examples here of PSAs that have been used in Canada, I want to draw your attention to one that was recently done by Toronto Crime Stoppers. It's just from the last month, and essentially we've only taken a clip from the last 15 seconds or so, but really what this PSA shows is a chemist in a lab making Molly, it's called cooking with Molly, and showing that it's adulterated. So if we can turn our attention to the clip.
Don't spill it. Color, this is my signature blue, some binder. Got all that in there, you give it a good mix. Then we bring out our presser and we start pressing pills. And voila. Join me next week when we'll be cooking Molly with, what are we cooking with? Heroin. Awesome. We'll be cooking Molly with heroin.
Great. So this PSA, the fundamental intention behind it is to show that Molly is an adulterated substance. So it's addressing very directly one of the trends that we are concerned about as CSSDP. So in that intent, we fully agree with this PSA. It's done in a very clever, engaging way, and we think it's effective. However, there are two very deep problems with this PSA. So the first one is inaccurate adulterant information. So throughout the entire clip, they mention adulterants, but we showed you the last one where they referenced heroin. So heroin as an adulterant of MDMA is not a reality from two perspectives. One, rationale, and two, evidence. So from a rationale perspective, we know that chemists, when they're designing their drugs, they want to make the effects of the substance, they want to increase the effects of the substance. So knowing that heroin is a depressant and MDMA is a stimulant, this is not a common adulterant because it doesn't accomplish the effect, the intent of adulteration. Secondly, adulterants are a cost-effective way for chemists and drug dealers to increase their profit margins. Heroin is a substance that can be sold at high market values on the streets. It's not a substance that they're using to cut MDMA with in order to, as that would detrimentally impact their profit margins. So essentially, including heroin, in addition to the rationale reason for why heroin isn't used, is if we also look at evidence, ecstasydata.org, which is a platform that's been around since the early 2000s in Canada and the United States, and collects data on the adulterants as people send in their pills to see what was actually in them, actually shows that in Canada, since the early 2000s that this has been around, there's never been an MDMA pill cut with heroin. So this is just purely inaccurate adulterant information. It's coming from a fear-based perspective in which heroin is a scary, stigmatized drug that they're choosing to include to deter people from use. But as an ad that is clearly targeted towards young adults, towards people that know what the word Molly means, that's not honest, fact-based drug information that they deserve. So we feel that that's deeply problematic. A second deep problem is zero harm reduction tips. So as I mentioned, this ad is clearly intended towards young adults who know what Molly is. So to know what Molly is, perhaps you've encountered the substance, perhaps you have friends that have used the substance. In some way or another, maybe you've considered taking the substance. So if you see this PSA and you understand what it is referring to, it's a perfect opportunity for you to be provided with harm reduction information in the case that you do decide to engage in the substance despite the warning here. So the lack of harm reduction tips is deeply problematic because it's a huge lost opportunity to reach out to youth whose health is just as important as the youth who do not choose to engage in the substance. So because of those two problems, CSSDP issued a response. We did a video remix. We decided to dub all the adulterants in the video with actually the most prevalent adulterants that are found in MDMA, as according to ecstasydata.org. And we also included a list of harm reduction resources at the end, so that people who do choose to use these substances are provided with the information they need to stay safe and to prioritize their own health. And you can visit that at our website and also at this link that we have there. So I will now pass it off to Lisa to discuss harm reduction.
So there's a lack of funding for youth harm reduction programs in Canada, and this actually fuels drug-related deaths and health complications. So today we're going to talk about a harm reduction strategy which isn't currently implemented in Canada, which we are advocating for, which is drug checking. So drug checking is a way for young people to examine their substances and screen them for adulterants before they use them. So unlike other overdose prevention technology like naloxone, where you give it afterwards, this allows them to know what they're taking and have information about the product. So there are different types. There are reagent testing, which are widely available across the United States. In Canada, you can buy these tests online. The police also use them. Thin layer chromatography, which is used by Energy Control in Spain. And then we have these lab-based systems. So, these might be based in a hospital and poison control centers. And in Europe, they're actually in public health centers. Like in Austria, there's Check It, which we're going to on Friday. Ask us about it after the presentation. And they actually have these machines which are becoming more and more portable. So Check It has a portable lab that they bring to parties. This is from Dr. Fiona Measham in the UK. She has this documentary, How Safe Are My Drugs? That's by BBC. So it's really great. We have the URL there that if in case anyone wants to check it out. But this technology is becoming cheaper, it's becoming more portable, so there's no excuse for public health not to adopt this across Canada and across the world. So there are several outcomes associated with drug checking, which are good for governments, public health, hospitals, and also people who use drugs. So the first one is drug monitoring. So it allows governments to know what drugs are out there. And Europe has done an amazing job when it comes to drug monitoring, and I hope we can do the same in North America. The second is alert system. So if there is a substance that's problematic, you can let people know. You can let public health know, you can let emergency services know, doctors, and that way everyone's in the loop, including drug users. It also increases the quality of treatment prevention and harm reduction because we actually have real data on what drugs young people are using. Most importantly, it prevents deaths. So, having knowledge about what's in your substance means that you might not take that substance if it has MMA in it or other drugs which have killed people. It also decreases the negative effects for short-term and long-term. So this is all evidence-based, it's implemented across Europe, and there's a lot of really good data on the outcomes for drug checking. We've taken this data, we've created a policy brief, which we've presented on Parliament Hill. So we've been lobbying our politicians to integrate drug checking. And this is us at the Capitol in Canada, in Ottawa, advocating for drug checking.
Great, so to conclude, I just want to make it very clear that the two trends that we assessed at the beginning that we presented to you about the rising risks associated with NPS and the risks associated with the misperception of Molly or MDMA as a pure substance, they're really addressed by what we're recommending for prevention to do and for harm reduction to do. So we can really reduce the risk associated with young people taking drugs and keep them safe. And this is really important because drug policy, bad policy, like how harm reduction and prevention is implemented that we've illustrated here, costs lives. We've lost many young people in Canada as a result of inadequate harm reduction services and poorly designed prevention campaigns that lack harm reduction information. So more pointedly, these are implemented this way as a result of prohibition, but if we can't begin talking about that, at least we can begin talking about how prevention and harm reduction can actually prioritize the health of youth despite their decision to engage in drugs. So thank you.
Thank you very much. Next we'll hear. Next we'll hear from Students for Sensible Drug Policy UK. Aisha Mia is the president and is a student at the University of Manchester and the London School of Hygiene and Tropical Medicine. Judy Chang is their international officer and she is in the PhD program at Curtin University.
Hey everyone. So today we'll also be using the pillars of drug use prevention and harm reduction, and we'll use this as a lens to frame our discussion of how policies and programming affect youth in select countries across Europe. So in 2014, SSDP UK collaborated with YODA, which is Youth Organisations for Drug Action, on this report, so Drug Youth. So basically brought together a network of youth across European countries who are interested in working towards drug policy reform. The report provided scoping analysis across 7 European countries, which are pictured here, and looked at drug use patterns, national laws, provision of harm reduction services, and treatment. So Aisha will be looking at prevention.
Okay, so I'm going to be talking now about prevention. So when talking about protecting youth, many government policies often focus predominantly on prevention efforts which are all around fear-based rhetoric and just saying no to drugs and completely abstinence-based kind of approaches. So in the UK we have something called Talk to Frank. It's a national drug education service set up in 2003 from the UK Home Office and the Department of Health. So it's a website with lots of information on it and various resources. It's got a hotline that people can call, a chat bar, email service, and a service where you can sort of type in where you're from and then find out about local treatment and counselling services in your area. And this is accompanied by various media campaigns like adverts that go out nationally on TV. So this is supposedly quite a popular service according to their figures. Approximately 8% of young people know about the service, and 68% of young people claim that it was as a service that they would refer to if they would need it. But despite having a relatively more subtle approach to, trying to prevent drugs, it's still quite strongly fear-based. You can sort of see by this cannabis mess with your mind quite, it's just kind of a ridiculous picture, really. Like, you look at it, come on, you know that that's not really what happens if you have any experience with drugs. So many very young people who use, they may be influenced and they may be, scared into not using, But as people grow, as young people grow, we all know that, the variety of sources of information that young people have available to them. So it's always dependent on their context, their peers, their social situation, their cultural situation, the kind of websites, social media that use. All of these factors influence young people's decisions and their behaviors. Okay, and all of these things are going to have a much stronger influence then compared to something like Talk to Frank. So, when you have conflicting messages between, something like this message with cannabis, messes with your mind. And then, people maybe in your school or in your area, they're using, and, it's completely opposite to what they're seeing in real life. It completely contradicts their lived experience. So, it just completely undermines any efforts and any messages that any departments of health or government is going to try and send out to try and, reduce any harms or prevent young people from taking drugs. They're just not going to take it seriously. And I know amongst many young people that do use, it's just seen as a joke. Like, Talk to Frank is just a massive joke. And on top of that, it doesn't really address poly drug use. It doesn't really address local trends and what's going on. It's just completely disconnected from the reality of what young people really experience. And so, as I mentioned, young people lose faith in the information that they're given and the government. As a slight side note, another sort of very common approach to prevention is obviously drug education in schools, which again is very much so just say no to drugs and all the fear and all the harms about drugs. So, in the UK, you may get once or twice in school, you'll get one lesson talking about drugs. And in the rest of Europe, however, there are many countries that don't even have any drugs education whatsoever. And again, this may be quite contradicting with what young people are actually going to be experiencing. So I'm going to show you a little bit of data from the UK in trends in illicit drug use. So you can see this is actually a government report. It's findings from the 2013-14 crime survey for England and Wales from 2014 August updated version. So the black line is any drug use in the last year among 16 to 24-year-olds, and the orange line is any Class A drug use. You can see that Class A drug use is relatively stable, and there seems to be a very slight decline in any drug use, except for you can see there's a slight upshoot in the last couple of years. So we want to try and understand what is it that this means. Now, many people in office are going to try and use these figures and say that, look, what we're doing is working. Talk to Frank works. Our education and prevention efforts work. But we have to be very careful about correlating any kind of signs of decline with what's going on out there, you know. So we have to make sure that we understand the difference between cause and effect here. You can't prove the correlation between current policies and the fall in drug use. Another problem as well with current prevention efforts is there's little to no evaluation to see whether or not they really do achieve their intended aims in stopping young people using drugs. And whatever little information that we might have out there, we know that, you know, all these media campaigns, things like these websites, it's extremely costly, and most of the time it's just highly inefficient. It's just not working. We know that it's just not really, it's just falling on deaf ears, really. So this lack of evaluation also is a major problem. So it's obviously preferable that young people don't use substances. We all can agree with that. But the reality is that young people will use, and they can use. And if they do, they should be given the right kinds of information. And we're in a really bad state of affairs if, you know, for example, the Department of Health can't even be taken as a credible source of information because already they've given us so much bad information that people just aren't going to trust what they say. So this is a very, you know, dangerous situation to be in, especially amongst our young people. So we just want to make sure that, you know, drug policy that is aimed at protecting youth actually doesn't cause more harm than good. So, you know, we want to make sure that it acknowledges the root causes of use. We want to remember that young people are smart. You know, we do have various sources of information. We live in an internet age, a technological age, where there is so much information out there. You know, we have to remember this and, you know, respond to the situation as it is. And we can't have young people lose faith in, you know, sensible messages that can come out and do come out from, you know, authorities and the government. So we want to make sure that the focus on prevention is not the majority and is not the predominant focus of how we prevent young people from the harms of substance use. We want to make sure that it's adequately complemented by harm reduction services, which are much less costly and much more effective overall in preventing harms from drugs.
Okay. So next, I'm moving on to harm reduction. I'm focusing specifically on harm reduction for injecting drug users. So I think most people would be familiar with the comprehensive package of UNAIDS, WHO, UNODC, comprehensive package of 9 interventions, but we find throughout most of the European countries they're not integrated, and mainly the provision is opiate substitution therapy and needle syringe programs. So many studies show how effective these programs are. They are cost effective, they're good entry points into other healthcare and support services, and they avert HIV and Hep C infections. So here's just some data collected on that. IS 1 point shows with governments, for every $1 invested in needle and syringe programs, there's a $4 return on saved healthcare costs. However, the problem is that youth face very significant barriers in being able to access these essential and life-saving services. So in almost every European country, the average age of an injecting drug user is 30, but this is not reflected in the percentage of clients being able to being enrolled in these services. So we want to look at the barriers and of why this underrepresentation occurs. Okay, so number 1, legal age restrictions, which is a major barrier. So many countries have age restrictions for entry into harm reduction programs. You can see in some countries it goes up to 20. In Sweden, also to this, there are criminal sanctions sometimes imposed on programs or individuals that provide sterile injecting equipment to minors. Another issue is requirement of parental consent for entry into these programs. This is obviously a problem as a lot of young people hide their drug use from their parents, or they may not maintain relationships with their family. So second barrier is a lack of specific services. So there's a lack of targeted harm reduction services. Research finds that, you know, drop-in centers, mobile services are much more effective in being able to reach out to young people, but most harm reduction services are provided with a clinic setting, which can be quite, it's not very engaging for youth. So being able to reach youth in places where they are and using creative approaches such as music, dance, art, has proved successful in other programs. There is one called Korsang, Core Mix in Cambodia. However, we find across the countries in Europe, there's a real lack of youth-specific services. In Romania, there was one UNICEF-sponsored pilot program, but that, due to lack of funding, that was closed down in 2012, despite being deemed a success. Okay. Third, the funding crisis for harm reduction. Obviously, this affects harm reduction overall. Harm reduction currently only reaches 70% of those that need them. But since we're talking about the need to focus on youth populations where there's high rates of drug use and need for youth targeted services, we really need to push for policies and advocate for policies that divert funding from punitive measures towards funding for youth-specific programs. So we wanted to all come together and we made a list of specific recommendations. And these are based on the need to acknowledge that a segment of young people will continue to use drugs regardless of drug policies, and therefore we need to start focusing on reducing the health and social harms of drug use. So some of our specific recommendations are there, and we'll open the floor for questions, I guess, based on...
We don't necessarily have time for questions, so perhaps we'll just read through these. We suggest that public health practitioners and lawmakers design fact-based rather than fear-based prevention campaigns, which are participatory and inclusive of young voices. Many times these campaigns don't ask young people, especially drug-using young people, how to best approach their issues, and so they are not relevant to the people who they are trying to target. We suggest that harm reduction information is included in prevention campaigns targeted toward young people. We find that very similar to abstinence-only sex education programs, if you aren't providing people with complete information about how to reduce harm if they choose to engage in the activity, they are more likely to end up with negative consequences. Ensure funding for harm reduction services in general, and in particular, those with a focus on young people, and lifting legal barriers to harm reduction services and parental consent restrictions for underage injecting drug users. Again, to sum up, we cannot pretend that we live in a utopia where young people don't use drugs, and therefore we must meet them where they're at and ensure that we are providing them with the services that are relevant and life-saving in those situations, while also creating better prevention programs that really address the facts on the ground for those young people. Thank you all so much for joining us today. We did run out of time for questions, unfortunately, but I'm sure that most of us would be happy to be available in the hallway if you have any questions following the program.